The NCLEX is going to make sure you know what goes into these because these are big safety concerns. So do you remember what's required for neutropenia precautions? Well, we want to put them in a private room with dedicated equipment so they don't swap any bugs with a roommate. And they cannot have any fresh flowers or raw foods because these can harbor bacteria. And then for bleeding precautions, we want to avoid invasive procedures like intramuscular injections. Don't give any aspirin because that's an antiplatelet. And then teach them to avoid forceful nose blowing because that can cause epistaxis that doesn't stop. And then to limit nicks in their gums or skin, teach them to use a soft toothbrush and an electric razor. And then notify the healthcare provider for any unusual bleeding. So obviously it's not unusual if we discontinue an IV and it bleeds for longer in these clients, but it's unusual to see bleeding from somewhere we're not supposed to, like petechiae or bleeding from their gums or in their stool. And definitive treatment with leukemia is with chemotherapy and or a stem cell transplant. So while they're undergoing chemo, we want to address the side effects of chemotherapy by giving antiemetics, performing gentle oral care, and monitoring their CBC, especially during their nadir, which is that lowest point in their neutrophil counts. And this usually occurs about 1 week after their chemotherapy treatment. And then after chemotherapy has destroyed that cancerous bone marrow, they might undergo a hematopoietic stem cell transplant. And this is where healthy donor stem cells are administered by IV and they graft into the bone marrow and start to produce normal, healthy cells again. But if those donor stem cells start to produce autoantibodies against the host, this creates a kind of acute rejection called graft versus host disease. And this is going to cause some non-specific findings like rash, liver dysfunction, and diarrhea. So be sure to monitor for these, like monitoring your liver enzymes, and notify the healthcare provider of any changes.